Here's your friendly breastfeeding reminder of the day that while pump flange size absolutely matters, and we want to be measuring our pump flange and having the correct diameter to our nipple shield sizing does not follow the same guidelines as pump flange sizing. So when we were doing an appropriate breast pump flange size, we're measuring our nipples, we're trying to find the correct diameter based on our anatomy. But when we are using a nipple shield, we have to remember that there are two patients involved. We have a baby's mouth and we have a maternal nipple. And we should not be sizing our nipple shields with the same diameter as our pump flanges. There is a little bit more of a science behind the shield that we want to use. So when I am placing a nipple shield, I am considering the size and diameter and shape of the nipple as well as the baby's mouth, because too small of a nipple shield can actually cause air pockets in baby's mouth where they can swallow more air. They can have a harder time latching to the nipple shield depending on the size and shape. There is more of a science to nipple shield placement and sizing than just whatever's out there and just pick a size or measure the nipple and that's the diameter, right? So what I'm really looking for is the shape and length of the nipple. Is it a flat nipple, inverted nipple? Is the baby's mouth, is it a high arched palate or a flat palate? Why we're using that nipple shield when picking shields. We have cone-shaped shields. This is what you're often given in the hospital. Going a little bit bigger in this size can help get a little more tissue in baby's mouth, but they can tend to slide on and off of this. I usually prefer a cherry-shaped shield. This is a Mammovac shield. Or I really like the shields from Lactation Hub. They do stick to the skin a little bit better, and they tend to be kind of a cross between the cherry shape and the cone shape. So usually I'm going up just a little bit bigger than the maternal nipple on shield sizing. You want to have the nipple about 1/2 to 3/4 of the way into the shield, but not all the way to the tip. I have seen a lot of nipples spaghetti Play-Doh makered through the tip of a shield when the shield is too small and the baby has too strong of a suction. So no, you should not be measuring your nipples and using that same diameter for your nipple shield. If you are using a nipple shield, please make sure you're doing that under the guidance of an IBCLC lactation consultant. If you feel like your lactation consultant was like, this is the only shield available on the market, that's a big red flag. And know that there are different shields that can help baby latch for different maternal and infant anatomy. Now you know.